Well, hello, everyone. We know everyone is still joining us, but we want to make sure that you know you are in the right place. So thank you all for joining us for the Achieving Generative Leadership through the Human Services Value Curve. We like to start off all of our sessions with the promise of community action. So feel free to say that along with me in your homes or in your offices. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we're dedicated to helping people help themselves and each other. So we are, again, so excited that you all are here with us today. We have our dynamic presenters and support. This is in conjunction with the APHSA. We have Jen Kerr and Tina Wright-Irvin who will be here supporting us, but this session will be led by our very own Jason Parent, who is the Executive Director and Chief Executive Officer of Aroostook County Action Program, or ACAP. And we are excited for this time. Before I hand off to Jason, I just want to make sure everybody knows that this will be an interactive and engaging session. So we hope to see your faces. We hope to see your cameras on, and know that we are certainly looking forward to hearing all that you will learn in this session. With that, I will hand off to Jason Parent.
Thank you so much, Lily, and good afternoon to those of you on the East Coast. To those of you in other parts of the country, good morning. It's great to be with you today. I will be co-facilitating this session with Jen Kerr and with the support of the lovely Tina Wright-Irvin. So we will be sort of tag teaming this as we go along, as I think an interactive and dynamic presentation, not only from you as participants, but from our facilitators as well. And I think we have the great perspective from both organizations, from the perspective of a CAP agency and from a perspective of the human services in terms of the development of this proposal and the work that goes behind it. If we could bring the first slide up again to remind folks that what we're asking you to do at this point is to tell us about yourself in the chat because of the number of participants that we have. So if you could please just place your name, your role, and what you hope to learn today, some nugget that you hope to walk away from. Having looked at some of the responses so far, I was glad to see that we have a coach in the room that's hoping to learn more about how this work and this approach will benefit a coach. And I can tell you from the perspective of our agency, we have about a dozen coaches across our county, and this work very much ties into the work of a coach. In fact, it's pretty much tailor-made for coaches in our agency, and something that I certainly recognized in the first time I was in a presentation on the human services value curve. So please do continue to put that information into the chat, and we'll continue to look at those as we go along through the presentation here today. Let's go on to the next slide so that we can sort of give you a sort of lay of the land of how things will go in today's agenda. And there will be opportunity for conversations. We'll do some breakouts a little bit later in the presentation to have some opportunity for you to reflect on what we'll be presenting, but also to make it very real for what you're doing in your community. So first, I'm going to start by introducing myself again. Lily introduced me quite well as well, but I just want to give my co-presenters the opportunity to tell you a little bit about themselves as well. My name is Jason Parent. I'm the CEO of Aroostook County Action Program. And for those of you who are wondering where that is, the northeasternmost tip of this country. Our agency serves a county geographically larger than the states of Rhode Island and Connecticut combined, with a population of about 70,000 people right up along the Canadian border. And it's going to be a high of about 50 degrees here today, which is a heat wave compared to what we see here in the winter. So our agency provides comprehensive social services with over 40 programs and has really embraced the whole family approach. As well as comprehensive service delivery, which is something that I wish we would have had earlier exposure to the human services value curve, because it really ties very well into how you make an agency really reflect the whole family work across your agency, not just with families that deal with children and families altogether, but across the agency. So I'm very pleased to be partnering with friends from the American Public Human Services Association, and I will ask them to introduce themselves now. Jen, let me begin with you.
Sure. Thank you, Jason. And so my name is Jen Kerr. I am the Director of Organizational Effectiveness or Technical Assistance with the American Public Human Services Association. And I welcome you today from the state of Pennsylvania. And so I have been with APHSA for over 6 years now. My start started with Philadelphia Department of Human Services, so Child and Family Services at that standpoint, and spent a lot of my career at the University of Pittsburgh at their Pennsylvania Child Welfare Resource Center, doing training, technical assistance, curriculum design, support work in that sense. So really, really excited to have the opportunity again to partner with Jason for today's session. Tina.
Hello, everybody. Good morning. It's still morning where I'm at. I'm in Southern California, and I'm an organizational effectiveness consultant working with Jen at APHSA. Started actually in San Bernardino County here in Southern California as a frontline child welfare social worker, and kind of transitioned into doing training and development for children and family services, and then ultimately for the county as a whole in organizational effectiveness. And very excited to be here with everybody today. And I'm going to be helping out behind the scenes. If anybody has any questions or anything, I'm going to be monitoring the chat if anybody has anything like that. So just let me know. I'm excited to get started.
Right. Thank you so much, Jen and Tina. Now, in terms of what I'm seeing in the chat, what a lot of you are looking for is directly connected with leadership. And I think that from a good news perspective, I think that a lot of what the Human Services Value Curve presents us, those of us who are leaders, with is really the opportunity to shift and focus our agency from that highest level, but also organically throughout the organization, and to really bring about comprehensive change in the way that we approach our work. So I think this ties very well to those of you who are looking for guidance around the leadership perspective of the Human Services Value Curve, because strong leadership and the ability to really pivot an organization to organizational change management are critical components of really leading an effective organization moving toward the Human Services Value Curve. So what we're going to cover today essentially is providing you sort of the Human Services Value Curve 101, giving you the nuts and bolts, talking about what it consists of, and how it's really, as you look through it, and as Jen will explain in just a little bit, how it really is a continuum and a process that doesn't leave behind necessarily in full context one state of being, but really looks comprehensively at putting the individuals you're serving in the center of the work that you do. We're going to also look at examples of a value curve work, and you're going to talk about some examples in some of your small breakout sessions of the work that you do in your organization and how you identify that along the Human Services Value Curve. And then we're going to really get specific about how you can help directly apply that value curve to the work that you're doing in your respective agencies. So with that, I will pass it on to Jen to go through the nuts and bolts of what the value curve is all about. Jen?
Thanks, Jason. All right, so what is the value curve? And so when we talk about the value curve, I really am talking about it is as a lens. It is a progressive lens, and we'll talk about that kind of goes through four progressive stages from regulative until generative. And as Jason just shared, it really takes the individual or consumers' point of view at the center, right? And so instead of as an agency looking in to a service, a program, a job, a task, whatever it may be, we are taking it from a family or individual's perspective and looking out. And so we will talk a lot about what that looks like today and throughout the next hour and a half or so. The value curve is not another thing. So for me, it's not a new framework. It's not a model that has to be used or, we're telling you to do in addition to. It really is a way to look at the work that you're already doing, right? You're already going to be developing budgets, you're already going to be taking a closer look at your agency and developing a strategic plan or something. So it's just a way to do it from a different lens and a different perspective. It was developed about 10 years ago in partnership with Harvard University's Leadership for a Networked World. And it was developed with human services leaders from across the country. It was tested with human services leaders. You know, it was through a leadership retreat that they said, we really should be looking at things from a different perspective, right? From a different lens, if we are best serving our communities and the families in which that live. The other purpose of the value curve was to look at things not only from an individual's perspective, but across sectors. So how are we looking at, we'll talk about generative, but bigger than the human services system, that community-wide perspective, and all of those moving parts, whether it's education, legal, aging, all of those moving parts within the community, and how the value curve or the lenses of the value curve can lead to collaboration, creativity, and innovation. Tina, you can go to the next slide, please. Okay, when we talk about the value curve, I kind of really always start with the basics of change. And for me, this is kind of the key piece for the value curve. We always have our green circle of where are we now, right? And so this, I like to say when we talk about change, is our current state. We then have our blue circle, which is our future state. That's where we want to go. But how we get there, that's the lens of the value curve. That's how we can see what we need to do from a regulative perspective, right? And we'll talk about what this means from a collaborative perspective, an integrative perspective, and a generative perspective. Go ahead, Tina. Okay. Some of the things that, you know, or basic principles I like to say, two of them really, for the value curve that makes it different is the value curve is looking at things from, you know, when you're talking about services, when you're talking about customers, you're talking about the impact the program services and benefits have, not the delivery of services and programs and benefits, right? So what is the impact these programs have on families, individuals, and communities? And then the other piece is the transition for me for thinking from outputs to outcomes, right? And so that's another key piece. And one of the ways I like to talk somewhat about this is that your agency's budget, or, you know, the services that are offered, let's say, by your agency, they are not driven by the budget. The budget is developed by the services that are needed within your community, right? So we're not only offering $10,000 of housing services because that's not all that our budget allows. We're offering housing services. You know, the amount of money we can put towards that is driven by the need within the community, the need within, you know, that generative or bigger than the agency perspective. All right, so the value curve itself, thanks, Tina. The value curve itself really is not a curve, right? So it's this kind of model or framework that looks at, as I said, 4 progressive lenses. So the orange lens is around regulative, and Jason will talk in a minute around what that means. Purple, collaborative, integrative is green, and blue is generative. And it really helps us look from an individual's perspective of our effectiveness in achieving outcomes, as well as our efficiency in achieving outcomes. And so that's how we're kind of moving along, and we'll share from the examples that we talk about today. All right, Jason, back to you.
All right, so this is really where we begin to look at each of these specific sort of slices of the pie, if you will. And I think that from the perspective of CAP agencies, if you're representing a CAP agency and joining us, and obviously this is a community action partnership webinar, so you are likely from a community action agency, this is where things really start to resonate in terms of how things operate within your organization. And I noticed that a number of you were looking at in the chat about how you're looking toward moving toward a more whole family approach. And I can share with you that this is as Jen has pointed out, something that doesn't necessarily add a layer or a level of work, but helps to put this work into context for folks across your agency, again, regardless of whether they're working directly with the families with young children in that way. It sort of allows you to be able to support that work and make others across the organization understand how important it is to really put the individuals and families that we serve in the center. So when we look at the human services value curve, we look at in sort of ascending order, if you will, but all of these sort of click together, is the regulative. The regulative is the basic foundation. It's really ensuring that you're meeting the deliverables that your funding sources are looking toward. Now, the peril to solely living in the regulative era, and I understand that, because when I joined our agency 6.5 years ago, I think we were so focused on the regulative era that we literally had staff that felt like they were more engaged in working for, in some cases, the funding source, the grantor, rather than the agency as a whole. So our home energy assistance program staff often saw themselves as being more insurance and compliance with Maine housing than they were understanding they were a greater part of the agency. Now, the trick to this is not to sort of throw that baby out with the bathwater. This is where a lot of agencies feel that dreaded siloing that happens in terms of programs being very, very focused or hyper-focused on regulatory and compliance. Those are critically important components to the work that we do. But if we stop there, we're never going to sort of break that cycle of working in silos. Really, where you progress from regulative, and a lot of the work that our agency has been focused on as we've transitioned and really transformed into a whole family model, which is consistent with the human services value curve, is working sort of up the scale as it would be related to the human services value curve. You move toward collaborative, you move toward that single door approach where you're basically working to link people across programs and services, really taking away that burden of them having to retell their story in some cases multiple times, fill out the same data forms multiple times, really making that ease of transition and providing those services in a more holistic way as you continue to work toward becoming more integrative. So the integrative work that you're looking to address really looks at the problems and the challenges that the individual or family is facing, and looks at how you're going to solve those problems beyond just providing the patchwork quilt of connecting them to services, but how that actually can come together and work collectively to try to solve those problems. So a lot of the whole family work really begins to exist between the collaborative and integrative work, if that's the area that you're focusing on. And then ultimately, you want to really work on a generative approach. And I would, again, look to all of you who have to complete, as we all do, comprehensive community assessments every 3 years. And that's really the intent of the generative approach, is really using that population-based health and the well-being of your community, finding out what essentially those needs are, and then going back and looking at the root causes. And to what Jen's point is then looking at whether it's your community services block grant funding or other funding that you have within your agency, how you make that work to meet those needs of your community in a way that really mobilizes all of the resources that you have. So let's move on and look at, again, the specific pieces of that, going through each of the individual and moving from that regulative lens. Now, again, moving from that regulative lens, a critical understanding of that for folks is that you're not necessarily leaving that behind. As you know, we have compliance to follow, but I will say one of our colleagues that runs the Community Action Agency out of Nashville, who was a colleague of ours in the whole family community of practice that we engaged in, shared something that I thought was extremely insightful. And that was, we've transitioned our agency from being an agency that effectively manages grants to impact community change to an agency that's impacting community change by effectively managing grants. And so if you think about that and how you flip that switch, it doesn't leave behind the importance of the program compliance and the regulative component. It just flips the switch in terms of moving up to, and let's go to the next slide here, to the collaborative lens, where you're really looking at that single door approach and looking at making the engagement with your agency that much easier for the customers and clients that we're dealing with. And then as you move beyond that, as you now have your programs working collaboratively, you can think of and really begin to look at what is the root cause that's causing this. Again, really getting to the heart of what we do in community action, the heart of why community action exists to begin with, is to solve those deep-rooted community problems. And they vary across the country. And that's why the data that we collect through our community needs assessment really allows us to determine what the challenges are and what the issues are that are presenting those challenges in our community. And then as we move beyond integrative into generative lens, really thinking bigger than the problems themselves and thinking about how we collectively can look at the systemic barriers that are presenting the challenges that are creating the barriers that, if they would be improved, would benefit our entire community, individuals that we serve, but also the community as a whole. All right, and so as we move forward and we look at how we align the value curve with community action agencies, I've been trying to weave that in throughout our presentation today. But think of it in terms of these parameters. When we look at the regulative side of things, we're looking at those contracts that we have, the contracts that we have with our Department of Health and Human Services, the programs that we have with our local state housing authorities, or whatever the case may be. Those are important for us to, again, maintain compliance and promote that effective service delivery. But if we stop at just doing that work, we're really putting patches in the holes in what are impacting the individuals and families that serve us. We're providing a valuable service, and the importance of providing that effectively and efficiently and meeting essential guidelines is critically important. But if we stop there, are we really impacting and making a change in the lives of the individuals we serve? So as we move forward along the continuum and move toward collaborative, think about it from a terms of increasing and improving that cross-programmative effectiveness. When you move to a collaborative state, you're removing those barriers that help people access that full array of services. One of the things that we've been, I think, successful in doing in this pandemic era is that as individuals are coming to us, we are the provider, obviously, of the Home Energy Assistance Program, but we're also the provider of the Emergency Rental Assistance Program. And so we know that individuals who are economically qualifying for the Home Energy Assistance Program, that the income threshold and the guidelines for that are more stringent than they are for the Emergency Rental Assistance Program. So we're actually networking. So we're doing a comprehensive intake for both of those programs, but then we're also working with getting all of the presumptive eligibility done for every other program that we have within our agency. And as we sit down with the 6,000 customers that come to us each year for the Home Energy Assistance Program, we're able to connect them with all of those other programs. And we're continuing to work along that continuum to go from collaborative to integrative to the next section, where we're really looking at moving beyond just the getting that referral out and having an individual contacted by the referral or the other program source, but really looking to be able to triage that in one setting and in multiple settings that follow, but to be able to connect those individuals with all that information, including using some of the case notes that our family coaches, if they are working with a family coach or if they're working with a navigator, because through some of our CARES Act funding through CSBG, we initially and continue to employ additional navigators, because we've had so many individuals who have turned to us throughout the course of this pandemic and said, who have never interfaced with our agency before, completely don't understand the social services network and where they need to go for various pieces of assistance, and really help them by allowing them to go to a one-stop shop in terms of connecting with that navigator. But they really look at all of the data, all of the programs and services that are available, and are able to customize and design levels of support that are required to meet that particular family or that particular household's individual needs. And so we're working along, continuing in this spectrum. And I will admittedly say that we are continuing to work toward more generative work. And this is really where we really have a focus on that overall health and well-being of our community at large, and really, I think, consistent with the work that we all aspire to do and the work that we've all been challenged to do as community action agencies, where we're looking at proactively addressing the community needs at that community level. And then from that perspective, really looking at how we generate both systemic and long-term impacts that really change the trajectory and change the dynamic and really break the cycle of generational poverty and other challenges that the individuals that we serve are faced with. So that's that looking at it from a community action lens, that's really where you're working through this continuum. And again, as Jen emphasized, it's not that you leave one state behind and move into the next. It's really that optimally, when you're functioning in the human services value curve, all of these pieces and all four of these components really come into play and continue to be critically important. And I think that that's important for those of you who are looking at change management within your community action agencies. This would have, as I mentioned earlier, this would have been such a helpful thing to have early on, because I remember sitting there with all of our managers about 6 years ago in a room and having the Ascend Institute at the Aspen Institute, having that sort of continuum where you have the child on one end of the spectrum and the parents on the other end of the spectrum and whole family in the middle. And we asked all of our program leaders to take sticky notes and go place where they thought their program fell along that continuum. And in an aspirational way, everybody really wanted to go place their sticky notes as close to the center as possible because they thought that's the right answer. That's where we want to be. That's where the agency is trying to drive the bus, if you will, toward. And the reality of the situation is not everyone fell in that. And I remember the sort of dispirited looks on managers' faces when we started to go move those Post-it notes more to where actually they were. We didn't just do it. We sort of had an open discussion with them and saying, so tell me more about this. And then those sticky notes began to move. And what folks saw in that was that they felt like, oh, maybe we're not a part of this transformation. And the reality of the situation is, we realized that we had some work to do around that in generating sort of a parallel track of comprehensive service delivery. But what really comprehensive service delivery in our agency translates to is the work of the human services value curve. And so if you're looking for and are engaged in agency transformation at this point toward whole family work, this human services value curve serves as a great foundational communication with your staff and a great approach to be able to demonstrate to everyone how we're all in this together and how moving this entire agency toward this level of work happens when we focus on all four of these areas. So,
yes,
yeah.
Thank you, Jason. So before we kind of go further on this, just wanting to just check in. Jason shared lots and lots of information, introducing the value curve, talking about it from a service delivery lens, but also from a community action agency lens. So I wanted to invite you, if there were questions that you had so far, to put them in the chat, or I'll be brave, take yourself off of mute, and ask the question if you have anything so far. So I'll leave a few seconds, for people to think if they have any questions right now.
I have a question.
Go for it.
So I barely started in January, but I'm struggling with getting my staff to be on board. They kind of like shut down and don't want to participate. I try to do games and like try to make it fun and like exciting, but they just don't like it. So just any input on how to get them to engage or even share their thoughts. They're just very shut down.
Sure. So shut down with any and everything you're trying to do, or shut down, with a specific process change?
It's both of them actually. I did like a little presentation to kind of get them, I'm new, I'm not trying to make any major changes, but I just want to make sure everybody's on the same page, and they're still not communicating very well, and I don't know, it's just extremely difficult.
Jen, I can certainly share from our perspective because, Antonella, this is not anything that's unique to you. I'm sure many people participating in this webinar can certainly relate to that. I can certainly relate to that. We had a number of folks when I first came into the organization, when we started introducing the work that we were doing, which was really, before it was labeled Human Services Value Curve, was really foundationally that. What fundamentally helped is, I think that if you find and work with stories within your agency, because I think fundamentally, I would like to think that the people who come to work for Community Action Agency are vested in making a change and making a difference in the lives of the individuals that we serve. And nothing that I said or any of the other leaders in our organization who are trying to steer this bus in this direction would say was nearly as powerful or as convincing as hearing it from the individuals we serve themselves when we got it right and when we connected services, when we maybe were working in a more collaborative, integrative, generative model, and that it all connected and it made it work for the customer. So I recall one of our agency days, the one day a year that we bring our staff all together in person to connect with one another from across our vast region. We actually had a panel of individuals that we serve who we had connected with various services, that our workforce development team had connected with adult education. And we really had set someone on a trajectory for a greater career, but we were able to connect them with the home energy assistance program so they wouldn't worry about where their heating came from. We were able to connect them. They had a family with young children with WIC. We got them enrolled in the Head Start program. And this customer and others just like her were up there in front of our entire staff with a lot of intestinal fortitude, telling their story in their words, brought people to tears, and it really changed the perspective that some of our staff approach. Now, I'm going to be honest with you, you're never going to win over all of the people all of the time. And one of the first things that folks told me from the Community Action Agency in Garrett County, Maryland, who were mentors of ours and mentors of many others, was that not everybody's going to make the journey. Not everybody's going to make the journey with you in a transformation that really embraces this kind of work. There are folks that are very vested in doing work the way that the work used to be done. And so making that transition. So those two things would be my piece of advice. Number one, use the opportunity to connect the dots for individuals by making it about the individuals you serve, which is really about putting the human services value curve and the people in the center. And number two, recognize the fact that not everybody's going to make the journey with you, but hopefully after you start to show the human side of the human services value curve, that you'll bring more people along with you and that you'll be able to identify those who are just not going to make the journey.
Thank you so much.
And the other thing that Jason is absolutely right. The only other thing I would add is that for some staff, as Jason shared, like not everyone's going to make the journey. And for some staff, regulative is okay. And there's regulative does not mean bad, does not mean wrong, does not mean not enough. And so, recognizing that those that are doing regulative work or only want to be in that kind of, in this instance, box, that they're critical. That foundation is critical to help those that want to be a part of that journey and kind of hit that impact of that work through integrative and generative pieces. So I would just kind of share it from that perspective as well. But Jason is absolutely key, right on. So thank you.
And I would just add, I would just add to that, Antonella, if you can find some gems of stories or customers that you have worked with where somebody who's really, really focused in working in that regulative business model, but has sort of unbeknownst to them, sort of existed outside of that and done more collaborative or even integrative work. And you can bring that individual. One of the powerful things about that panel that we brought together, others of the stories that we've told in writing and shared with our staff, is that we bring in the staff's perspective from it. So the staff become champions in those stories for the individuals that they serve, and they start to see it from that perspective while they're able to retain that importance, that critical importance to honoring the legacy of that very regulative work and ensuring and seeing. And another bonus that I would say, I'll never forget, we had brought together in August of 2020, US Senator Susan Collins, who's a big supporter of the work that we do, with customers in an outdoor event at our center in our furthest southern part of our county. And we brought up some of our funding sources to be there with her. And the executive director of Maine Housing, who was really kind of skeptical about the work that we were doing initially because it was really thinking outside the box, he came and he heard firsthand from the people the impact that this blending and braiding and this more collaborative and integrative work that we had been doing, how much it made a difference. And it made him a believer right there on the spot. And it's done that with staff as well. So to be able to go up the chain sometimes and work with your funding sources and say, look, here are the results if we work this way. And being able to connect those dots for staff who are really, really more used to working in the regulative way is huge.
Yeah.
Wonderful. Thank you so much. I've been jotting all this down. Thank you.
Fantastic. And just kind of want to draw notice as we begin to talk about the leadership and staff leadership and how we can look at our roles as leaders utilizing the lens of the value curve. Karen shared in the chat that staff burnout is a thing, not only due to the large number served, but because so many agencies pivoted to more emergency support or responses with pandemic funds pushed out. So less connecting to kind of moving clients. And so thanks, Karen, definitely appreciate, or clients to self-sufficiency, sorry. So definitely appreciate that. And so really looking at things in general, you're absolutely right about the reactionary pieces and right. And so you're trying to spend money, right? Because some of it has deadlines by certain times. You're trying to have that impact, not just you're trying to work together, but you're trying to impact generatively through the whole community. And so what does that look like?
Yeah, I agree. And Karen, one of the things 2 months into the pandemic in, early May of 2020, one of our staff members, we were having at the time daily pandemic operations team meetings to keep everybody on the same page with it. One of our team members who was sitting in for our human resource director, so she was an individual, a human resource generalist essentially, sat in and she said at the end of the meeting, she said, I cannot imagine how our agency's response would have been to this pandemic and how much more difficult and challenging it would have been had we not already been down the path of looking at this from the perspective that essentially the human services value curve supports. So I agree. And that exhaustion and that staff burnout, and another layer that has been added to that is that many of us have brought in numerous staff members. So no matter where we were at in our own transformation initiatives, we were bringing in new people who had no knowledge of it and really no time to learn because you were moving forward. But with the right leaders in place and looking at things from this lens, I think we've been able to more successfully make those programs work more collaboratively together, even with the newer ones. There's never enough time, and there's not, quite frankly, enough human resource to be able to get it done as effectively and as efficiently as I think we'd all like. But I just add that to that because I think that, yes, we have staff burnout. It's a very real thing, but I can't imagine how much more compounded that would be if we weren't working in this regard.
Thank you. All right, Tina, take us through to staff leadership. Thank you. All right. So when we look at our roles as leaders within the agency, when we look at it from a regulative perspective, right? Leaders are directive. They are really strong at ensuring staff are clear about what their roles, responsibilities, or expectations are, both task and relationship. So leaders, again, leaders are very clear. This is what you're to do. This is how you're to do it. Really making those connections. This is who you can work with. And so definitely important, the foundations of the work within your agency, that regulative piece. Collaborative. These leaders are connecting expectations to the bigger picture for staff. So beginning to share with staff the why, right? So not yet understanding the why, but beginning to share the why with staff, right? So we work with families this way because, right? And so how it's connected to our agency's mission, vision, values, how it's connected to our strategy or collective goals, teaming with each other. And that teaming is within the agency. So kind of really moving from that silo service delivery or programmed functioning kind of model and cross-agency collaboration as well. But still recognizing at this point, leaders, you need to share that initial connection, right? You need to verbalize that connection. Staff may not be able to see that connection yet. Integrative. As integrative leaders, you're adaptive. You are facilitating versus sharing staff towards the collective development of shared goals. So earlier you had shared goals, you had strategy, and you shared it amongst a collaborative team. Now at the integrative piece, you're developing those shared goals and strategies with them, not for them. You're using data to do that. And at this point, staff are understanding the why they are important, why their job function or role is critical in the bigger picture of the impact and support for families and the community. And at the generative piece, the generative leaders, they're now connecting those collective goals and strategies, not just within their agency, with partners, with vendors, allies, stakeholders, competitors, right? So these are leaders that says, instead of going against agency ABC for the same grant, let's figure out how us and agency ABC can work together, utilizing each of our strengths to best support the family, right? And so working together as leaders, as agencies for the best impact for the families and communities in which we serve. So this is where innovation and transformation happens and comes. Go ahead, Tina. All right, so where are we now? At this point, we are going to transition into a lot more active work, as Jason had shared earlier and Lily had shared. The first part, let me just explain this full activity. We're going to give you a few minutes to think about your own role. So, right, so put your value curve glasses on, your lenses on, whatever they are today, and think about your own role and think about it for what is the type of work that you do on a daily, weekly, monthly basis that you would consider regulative? What's the type of work that you do that you would consider collaborative, that you would consider integrative, and that you would consider generative? We are going to give you 3 to 4 minutes to think about or self-reflect on that. At that point, we are going to, and we'll give you a heads up, we're going to transition you into small groups. In those small groups, you're going to talk about all 4 of these lenses as well with your roles. And then we will come back and just have a short, large group conversation to process out some of these pieces. So think about your own role, or program area, whatever you want to think about, using the lens of the value curve. What is some of the work or program area tasks that are regulative, collaborative, integrative, and generative? So my clock says 1:13 Eastern time. So at 1:17 Eastern time, Tina, we can transition into breakouts. Tina, can you put the leadership slide back on? Thank you. And as Tina, just a reminder, as she put the leadership slide on, the questions that were on the slide that we just moved back from are in the chat.
Tina has asked how we get into the breakout room. We're going to establish that in just a moment here. We're just giving folks some time to think before we send you into the breakout room to share with others. So it will become evident at in a couple of minutes how to get into your breakout room.
Yeah, thank you, Tina. So you have 1 more minute to kind of think on your own, and then everyone should get a pop-up on their screen that will invite them to join a breakout room. So just click OK, and you will be called to join that room. So you have a few more seconds to kind of wrap up your final thoughts on your end.
Right, so we're going to send you into your breakout rooms, and we'll be coming back together at 1:25 for the large group sharing. So if you haven't already, please go ahead and join the breakout room that you're called into. It should be appearing on your screen. Taylor, are you able to see? All right, welcome back, folks. So quick show of hands. How did that get more difficult the further you went from regulative to collaborative to integrative to generative to come up with examples? Was that the case? Did you find that in each of your respective groups, or did it flow very well? More difficult? Show of hands. Okay, I'm seeing some nodding. So I'm gonna, that's not an atypical CAP experience, because really the regulative environment is where so many of us have lived for so long. So let's sort of, folks want to get some of you to share, especially where there might have been themes that in your small group discussions you could sort of identify. Let's start with regulative. in terms of what did you, definitely identify as, gosh, we work very much in the regulative lens doing this work? Let's see, Katie, you're unmuted. Do you have something that came out of your group? Oh, sorry. You don't want to be unmuted, do you? Just want to look on your face.
No, sorry. I probably wouldn't be a very good person to ask since I was kicked out. It was only in there for about 2 minutes. So.
Yeah. Okay. So someone else, what did you come up with in your conversations around regulative? Anyone? Carrie.
Yeah. Well, I'll just say that we spent most of the time just getting to know each other and understanding what each of our roles was, because we were in three very different roles, three of us in the group, and just understanding that. And but we did, one thing I mentioned is it's often the kind of the regulators and funders, I mean, saying kind of the obvious, that keeps sucking us down into the regulation mode. And I'm a Head Start director, and Head Start is notorious for that. even on a conversation we had this week with them, just not understanding our desire to co-locate all of our services in one building, and then how we would kind of work that out fiscally between all the funders. And it would be easier, of course, if it was a Head Start only building, but of course that wouldn't be easier for families if it was only a Head Start building.
So Carrie, just quickly to respond to that, I will tell you that in our work to blend and braid funding to support the work that we do in a whole family perspective, Head Start has been our most at the table and most collaborative partner, ironically. And we've increased our family coaches largely on the back of the work of Head Start. And we have a center just like you're talking about. So if you'd like to reach out to me, I could connect you with the individual who sort of helped make that happen from a peer-to-peer perspective and be able to sort of provide you with some maybe technical assistance on how you can maybe get closer to that model. We'd be happy to do that for you. Carrie, did you have something else you wanted to share?
I just wanted to share, it's the 1303 facilities process that we're dealing with. So I don't know if you did that, but it's not that they're not supportive of the joint locate, the shared location or helping families. It's just makes their process that's already complex, really complex.
I hear you. It certainly does. And it's sometimes difficult to get them there, but gosh, it's well worth the effort if you do. So any other key examples on regulative? I know that we live in them every day. So okay,
Jason, I would just add, like, having staff do time cards
mm-hmm.
every, or, having them do expense reports or whatever they are, running payroll, those types of things would also be considered regulative.
Indeed.
I also have one. We didn't get enough time to discuss a whole lot of this. We did the same thing. We was trying to figure out who we are in the room. But on a different note, one of the things that I recently am doing with another entity here in Sonoma County is they gave us contracts and commitments. And so I'm on an interim board. And so they gave us our, this whole list of things that we're supposed to be doing. So we didn't get to discuss that, but I wanted to throw that out there because so many times when we get into our positions, we don't go back and look at why did we start this, right? And so what they did with us, they had this whole list of, are you going to commit to these meetings? Are you going to come and blah, blah, blah. So doing a contract or commitment where you revisit that periodically to see if you're still in step with what you're trying to achieve. And so that's one way of, kind of regulating what people are doing and making sure that they're clear about the role that they're playing.
Yes. Yeah, that definitely is a good way to start to move from regulative even to collaborative. So let's do that now and talk about examples that may have come up in your groups where you certainly saw and experienced a more collaborative work environment. Who had a really good example in this area?
I'll
You
talk
bet.
about,
Go
yeah.
ahead.
I'm not shy, so, you know.
I'm glad. Thank you very much. You're saving us.
So one of the things, by the way, I'm not an employee of CAPS. I'm actually a Shriver Fellow, but I do a lot of work in our community here locally in Sonoma County. So one of the things I talked about was we have this health action chapter here where we had chapters across our county. And we just recently found out that we didn't have any funding. So our county has put funds aside for boots on the ground and collaboration. So we came together as chapters, and then we developed a proposal to submit, which was submitted last week. Woohoo! Submitted a proposal for funding. And so each of the chapters are in different parts of our county, and they're very specific. Some are dealing with mental health, some are dealing with the ACEs, but we're coming together as a collaborative using the community health model and community health outreach. And so we have boots on the ground, people from our health department, people from just various areas, and we're all coming together and we're setting it up in a way where we're going to be meeting on a regular basis to talk about what's working in your area. This seemed to work for you. Let me see if I can try that. So we're trying to be very intentional when it comes to moving a narrative forward and making sure that we're doing the best possible thing for the people we serve in our community.
Great example. I would share also, and picking up from what Jen had said initially, some of that work that you're doing in budgets and things like that, although can be very linked to regulative. One of the ways where we've sort of moved part of our budgeting work into a more collaborative and even integrative work is in the planning around how we're funding and supporting the coaching work that we're doing in our agency. So to your point earlier, Carrie, about how we bring Head Start dollars to the table, how we bring Assurance 16, which is part of the HEAP assurances that allows us to do that coaching and case management work and extricate dollars from that area to do some of that and support some of that coaching work in a blending and braiding kind of way, brings together individuals and programs from across our agency in a collaborative process to form a budget that really supports us doing more integrative work. So let's continue into that conversation where folks able to identify, as after you got to know each other, and I realized that was a big part of it, and understand your respective roles within the agency, how may be more collaborative again, and then moving into integrative work may be happening within your organizations right now that you were able to identify.
We were really discussing data and its role in this crosses between collaborative and integrative. We have discovered that our data is not really supportive of our staff moving toward a more integrative approach, that it's difficult for us to pull outcomes across programs, and that, again, our funders are very much encouraging kind of a siloing of our data. And so we're working very hard as an agency right now toward a collective kind of envisioning of where our data lives, how much of that can live together, and what kind of universal intake we can build. To do that, we're implementing a new database, which really is very, very helpful in that, but still, it's a lot of work across the agency, connecting programs and asking questions like, have you done this kind of work? Are you doing developmental work? Well, they're doing developmental work as well. Let's talk and work together. And so it's a long process, but I think that it really speaks to both collaborative and integrative, kind of hopefully integrative in the aspirational sense. I think it'll take us a little while to get there, but that's what we're working on.
Yeah, Jamie, absolutely. And that is a great example. We've lived that experience as well. And I think I've heard now from you, and I've heard earlier in some of the questions that we received about how you bring staff along, that line of questioning around how you bring staff along in the process. Those two things in this climate, the culture and the ability to have data to support the work that you're doing, or to understand and to bring that data together in one place, were the two most significant impediments that we're still working on them today. We're still working on the culture. We've been working with a consultant for the better part of the last 6 years on this work. And she's telling us you're 80% of the way there. You have 20% to go, and that's the 20% that's going to be the most difficult for you. And we're still working on the data. We went through the same process you did in terms of how do we connect those data sets together to be able to ensure that they can speak so that we can see the picture of our customers in one place, from case notes to outcomes, to also which we've been using Empower, which is the Garrett County Community Action Agency sort of developed software off to the side. I apologize for my phone. But that has been most helpful. But even that is not at the point right now where we want it to be, because it requires us to be able to patch in multiple data sources from other funding partners, and getting to that place where you can actually do that real-time data exchange is a very heavy lift. So, but as we move closer to that, we can certainly see the benefits. And certainly when we looked back at some of the data from our initial pilot work in this regard, we had a 100% increase between 2017 and 2019 in the number of parents of children in our early care and education program who we had working toward a credential, either have had obtained it or were working toward it in that period, a 100% improvement. But we didn't really see that data until we were getting ready to report it, because we weren't able to track it in real time. But when we got to the end of it, we said, wow, that's really impressive. And what might we have done differently in other areas had we been able to track that data comprehensively in real time? So very good point, Jamie. So did anyone in their conversation move forward and say, gosh, this is a really great example of what we're doing in the generative environment? Did anybody get that far? All right, so I'm taking it no, and that is, I mean, I will say from the perspective of our agency, that is a place that we aspire to be. I think that some of the work that we do in our strategic planning following the comprehensive community assessment that we each conduct provides us with the great opportunity to look at how we work more generatively. So I would encourage you, as you're going through that process, as you're going through the comprehensive community assessment process, and turning that and transitioning that into your agency's strategic plan and community action plan, that you really look at opportunities in small, but obviously in large ways, because you're looking at community level change, again, exactly what we were designed to do, to how you can affect generative work and work generatively in one portfolio area or another. Jen, anything else that we want to bring into the conversation at this point as it relates to that, or are you thinking we're ready to move on to our group practice exercise?
Yeah, I think we're ready to move on to our group practice and maybe talk about some family engagement.
Yeah, so in this particular part of the breakout exercise that we're going to have folks to do, we're asking folks to do is really to think of it from the perspective of how we engage in the work, and we're going to look at 4 specific areas. And so this is where bringing in your respective hats from wherever you are within the organization is an extremely helpful and valuable perspective. So whether you're a leader, whether you work in finance, whether you work as a coach or in direct service and programming, this is where, how does your role fit into this in the table to work more collaboratively, integratively, and to look at how we can continue to work toward even more generative work. So we're going to look at 4 different topic areas. So let's bring that slide up on the screen. If we could, Tina. Tina's the master of bringing things up on the screen. Here we go. So we're going to look at things from the grant application perspective. So think about it. We all work in that environment of applying for funding, either to continue to advance our programs or to add new programs to our agency. There's the concept of budget development. We've talked about that a little bit, about how that exists for the most part, oftentimes in the regulative space, but how that can exist in a more collaborative, generative environment. Family engagement. So a number of you are working directly as coaches or within Head Start or in other programs, which family engagement is a critical component of that work. And as you're measuring that work and you're measuring those metrics of success, whether you're working with various programs in that early care and education environment or others. If you're a WIC provider like we are, we're working with family engagement in that area as well. How that can be done in a collaborative way, how you might change and look to work in a human services value curve way. And also the area of advancing race equity. So we're going to be breaking folks up by those topics here coming up shortly, and asking you to go into those small groups and have a discussion around that topic. And be prepared to come back and report out to the larger group what your small group talked about and how that work can exist within your agencies using the human services value curve and working across those 4 different regulative, generative, collaborative, and integrative work, that work lens, if you will.
So Jason, I'm gonna stop sharing this slide, but I did put in the chat the direction. So whichever, we're only going to have 4 groups this time, whichever group you get assigned to, that will be your topic. So group 1, you're going to talk about grant application and apply the lenses of the value curve to grant application. Group 2 will be budget development. Group 3 will be family engagement, and group 4 will be advancing race equity. So think about all of those different lenses of the value curve, starting from the regulative all the way up through the generative. So I'm going to put everybody into breakout rooms. So pay attention to what room you're in, so you know what your topic is. All right. You should be invited to a room now.
Sorry, Jen, I'm just seeing your note now. My chat had fallen off the screen when we shared, when Tina shared screen, and I'm
Perfect. Hi, everyone. We're just giving it another, I think, 10 seconds or so as everyone joins back. Okay. Well, welcome back, everyone. Welcome to the last 9 minutes. So we promise that we will have you out on time. And so just wanting to, the idea for the past 2 conversations was not to go in depth. It was just to kind of, I say, wet your whistle, get you to begin to think about these types of things. And so for this piece, I wanted to just talk about my grant application group. Is there one thing that you identified for regulative, collaborative, integrative, and generative? One activity or role, or as far as you got from my grant application group? So group 1.
We kind of talked about how grant writing hits all 4 of those areas, but obviously there's a lot of compliance involved with grant writing.
Absolutely. There's some key things that the RFP or whatever might say that you have to have in it. It might be linked to something. The best grants are going to be, again, cross stakeholder, cross partner, cross sector, you know, in their innovation or in their design. So more of that generative base. And then who has ever done a grant that hasn't had data included, right? And so those metrics, the what if, the so what's, so those pieces. Absolutely. Thanks, Megan. How about our budget development group? What are the different activities that you identified along each stage of the through each lens of the value curve? So group 2, the budget development group.
I think we kind of hit on, I just realized we probably kind of hit on grant application as well, just because we were thinking about all of the things that, goes into the budget when you're talking about what we can afford and what we can't. So I spent a lot of time talking about our 2-gen pilot that we currently have here at HRCAP and how we have been able to braid dollars to assist families with self-sufficiency as it relates to a culmination of things. I would say, I didn't mention this in the group, but I'm going to say it here so you guys can hear it. But as it relates to budgeting, I think in particular, our agency is more of in the collaborative, moving into the integrative stage.
Great.
And that's just because we have so many stakeholders at the table. We have so many individuals that we partner with. So I think we do a great job at, talking to individuals or other partners that we are working with to ask them, hey, what worked well for you as it relates to budgets, or what didn't work well for you? So trying to, and keep in mind, none of the people in our group were like our budget experts. So we're just going off of, what we currently know about our agency. But I would say definitely those line items like staff costs, things like office supplies, transportation, client services. You want to make sure you pay attention to those things. I know in particular, client services is a huge, huge deal. We kind of want to spend more time talking about how we can get more money in the pot or in that particular space versus other spaces like maybe office supplies and things like that.
Awesome. Thanks, Monique. And absolutely great to hear that you guys are having people at the table and that you're looking at past budgets and pulling things together and all of that as you are developing it. How about group 3, my family engagement group? What are the 4 kind of tasks or roles that you identified around family engagement, one for each lens?
I kind of took one task and applied it to the different stages.
Awesome.
So thinking about like a family needs assessment and goal setting process, and you've got your regulation, like you have to do it. It's required by your funder. You have to do it. And then, you could be checking the boxes or rating a family in different areas would be really regulative also. But then moving into collaborative would be making sure that you're having conversations with families, not just checking that box, not just getting a score, but like, why do you feel like this is where you're at, that type of thing. And then integrative would be more like setting goals with families based on their needs. So not like you scored the highest in this area, so you should set a goal in this area, but letting the family say what their need is and setting goals that they want to set and supporting them and finding resources that they're interested in or that will support them. And then generative, I would say more bigger like community needs assessments or changes in your community, different populations or different needs in your community, and then maybe looking at the services that the agency provides and adjusting the services to meet the needs of the community rather than saying, here's what we have, come if you want it, but rather seeing what the need is and then adjusting or adapting to the needs.
Yep. So the impact that the services that families participate in, what is the impact on, on the community, and how do we use the community needs assessment to look at the community versus look at our individual program, service, or role type of thing. Absolutely. Great, Julie. Last group, advancing race equity. What are your 4?
We didn't get through all of them, but my team, anybody can jump in. I just wanted we talked about looking at the outcomes from the beginning. So having some kind of metrics already set up as we're working through the process, because when it comes to race equity, you have to know what you're working with. So you have to have a baseline of where you are right now in order to move out into the different categories. So that was one of the things we discussed. Then one of the things, we had a grant writer in our room too, and she talked about, what does the race and the equity look like and how would you report that out? So you have to kind of know, it's like know you're in and then work backwards from that, right? And so if we have our in and what we're trying to achieve, then we can get there. And so one woman talked about, when you have some going up the management and so forth, sometimes it gets a little lonely because you don't see people of all colors there. And then when it comes to services, sometimes you don't have everyone receiving the same services. So again, it would go back to the metrics and see, hey, are we being intentional when it comes to providing the services? It's like, know who's in your community and then make sure that you're hitting the numbers based on the community that you're serving. And anybody else that would like to jump in, feel free.
No, you did great. Thank you.
Right. So some good discussion there. Jen, you're muted. Oops.
I was on mute. I was just saying, awesome job, everyone. Tina, turning it back to you.
All right. So with the time that we're running up against right now, we just have a couple of minutes left before the 2 o'clock. Want to just ask folks if they have any sort of last minute thoughts, things that resonate with them, confuse you, concern you about this, anything that you wanted to sort of share or ask at this point before we head out.
I would like to say this chart is very confusing, but at the end of the day, we do a lot of the work already in these categories. It's just maybe breaking it down in a way where it's so simple that people get it, because we've been doing this for years, but never had the actual model for it, right? And so we got to be confident in what we're doing out in the community, that it is touching all of these areas. And so just watering it down in a way like a fourth grader could understand it, and then everybody else would be like, oh yeah, we do that. So
Yeah.
Don't feel discouraged that you're not hitting the mark. You definitely are hitting the mark when it comes to, community action partnership. I see it in a lot of the programming. I get to hear from a lot of different groups across the nation in relation to what they're doing. So you guys are hitting the mark.
And I would just say, Yvette, you transitioned so beautifully, and Jason, I'll head back to you in a second, to what Tina just put in the chat, the Partnership Playbook. So the Partnership Playbook was developed specific to community action agencies with their own stories and examples and definitions for the human services value curve.
Absolutely. And I think, Yvette, that also leads into sort of these last points that we want to make for folks that, as we move into this environment, as we move into looking at this, it's important for us not to leave behind the regulative matters. It's not regulative items. It's not a matter of just saying that is not important anymore. It's clearly important. And to also think about this as not being a progression that's like linear or uniform, as I think in all of your examples in those most recent breakout groups that you did, it exists across the spectrum. Things exist across the spectrum and function best across the spectrum. And that in that regard, the stages of the human services value curve reinforce one another. And that organizations can be, I think, again, as you pointed out very well, at multiple stages, and that this isn't just another sort of way or layer of doing work or some added responsibility that we have, but really a good way to sort of describe and define the work that we're all aspiring to do. So with that, Jen, I'll let you have the final word.
Awesome. Well, thank you. On behalf of NCAP, on behalf of APHSA, we are so, so happy that you joined us today. And again, Lily or Peter will be sending out the deck, and take advantage of the Partnership Playbook that is linked in the chat. And have a wonderful weekend. Thanks, everyone.
Thank you.